Hi everyone, this is Tim, your Block 3 lecture instructor, and this PowerPoint voiceover is going to be on endocrine disorders, specifically Addison's disease and Cushing's disease. This PowerPoint voiceover is going to be fairly short. I broke it down into specific disease processes so that way it was just easier to understand. There's not a lot of stories. There's probably more reading of the slides than anything else, and that's really more because these two disease processes are important. They are something you need to know and learn for Block 3, but they're also something that most med-surg nurses don't take care of too often. So if I have taken care of a patient that has had these two disease processes, I've taken care of them because of other reasons, not necessarily specifically because of these two diseases. So anyways, let me know if you have any questions and we'll truck along. All right, so Addison's disease. The picture of this poor lady, who looks like she's having a hard time, is a picture of the kidneys as far as where they sit, and the adrenal glands sit on top of those kidneys. So Addison's disease is a disorder that occurs when your body produces insufficient amounts of certain hormones produced by your adrenal glands. In Addison's disease, your adrenal glands produce too little cortisol or often insufficient levels of aldosterone. For cortisol, it is works in conjunction with your adrenaline and noradrenaline to help regulate your reaction to stress. Cortisol also helps regulate your metabolism, sugar levels, and blood pressure. Aldosterone helps control your blood pressure by managing the balance of potassium and sodium in your body. So this slide, I broke down the adrenal glands into the medulla, which is the outer part, and the cortex, which is the inner part of your adrenal gland. Some of the hormones the cortex produces are essential for life. Specifically, glucocorticoids. These are the hormones that include cortisol, which influences your body's ability to convert food, fuels, and energy. It also plays a role in your immune system's inflammatory response, and it also helps your body respond to stress. Mineralocorticoids. These hormones, which include aldosterone, maintain your body's balance of sodium and potassium to keep your blood pressure normal. And the androgens, these male sex hormones, are produced in small amounts by the adrenal glands in both men and women, and they cause sexual development in men and influence muscle mass, libido, and the sense of well-being. For primary renal insufficiency, this is the failure of your adrenal glands to produce adrenocortical hormones, and most commonly the result of body attacking itself. So for primary renal insufficiency, essentially it's an autoimmune disease. For unknown reasons, your immune system views the adrenal cortex as foreign and something to attack and destroy. Other causes of adrenal gland failure may include TB, other infections of the adrenal glands, the spread of cancer to the adrenal glands, and bleeding into the adrenal glands, which may present as an adrenal crisis without any preceding symptoms. And we'll go over adrenal crisis in a couple slides. The pituitary gland. Your adrenal glands are controlled by your pituitary gland, another part of the endocrine system. It's obviously located in your head, and it's the main controller of the endocrine glands. Abnormal signals can disrupt the amount of hormones that your pituitary gland tells your adrenal glands to produce. This can cause them to produce too little or too much, and the hormonal imbalances can result in a variety of symptoms and health problems. For secondary adrenal insufficiency, this can occur if the pituitary gland is diseased. Pituitary gland makes a hormone called adrenocorticotropic hormone, also known as ACTH, which stimulates the adrenal cortex to produce its hormones. Inadequate production of ACTH can lead to insufficient production of hormones normally produced by your adrenal glands, even though your adrenal glands aren't damaged. Doctors call this condition secondary adrenal insufficiency. Another more common cause of secondary adrenal insufficiency occurs with people when they take too many corticosteroids for treatment of chronic conditions such as asthma or arthritis, and then they abruptly stop taking the corticosteroids. So as an example of this, and to kind of make this a little more understandable, if you have somebody who actually has COPD, And let's say there's an exacerbation, or let's say they have COPD and they end up getting pneumonia for some reason, a physician will put them on some sort of steroid as an anti-inflammatory. They'll take these for a certain amount of time, specifically probably IV because it seems to work better. And then once they are getting better, they will then switch them over to orals. They'll be on orals for a certain amount of time. Once they're no longer needing it, the doctor will actually taper them off the steroids until they get down to nothing. So they may take, 4 pills a day, and then the next day they'll take 3, and the next day they'll take 2, and the next day they'll take 1. The reason for this is that while a patient is taking steroids, the adrenal glands are not producing as much steroids as they actually normally would have, and that's because it's getting it from somewhere else. If you abruptly stop taking the steroids, your adrenal glands have not adjusted themselves to start making what was lacking. So that's why they tell patients not to stop taking them all of a sudden without tapering themselves off, is to give your adrenal glands some sort of time period to be able to catch up. So symptoms of Addison's disease, they usually develop slowly and often over several months. They may include extreme fatigue, weight loss and decreased appetite, darkening of your skin, and I posted a picture of JFK who had Addison's disease. It will also have a symptom of low blood pressure, possibly even fainting, salt craving, low blood pressure, nausea, diarrhea, and vomiting, abdominal pain, muscle or joint pains, irritability, depression, body hair loss, or dysfunctional, sexual dysfunction in women. So if you look at these symptoms to make this a little bit simpler, with Addison's disease, with the corticosteroids and the mineralocorticosteroids or the aldosterone, it's to control blood pressure, specifically potassium and sodium. So that's a possible reason why you're craving salt. You might also have the nausea, diarrhea, and vomiting, and the abdominal pain. Muscle and joint pains is probably because of the potassium being low. You might also have, let's see here, weight loss and decreased appetite, because obviously the cortisol is to help stimulate that and control it. And the extreme fatigue is probably because of the stress factor. So for diagnostics, your doctor will likely use blood and imaging to diagnose adrenal gland disorders. They will probably start by ordering blood tests. They can use these tests to measure your levels of adrenal hormones, pituitary hormones, glucose, potassium, and sodium. If they suspect that you have an adrenal gland disorder, they might order imaging tests such as an ultrasound, MRI, or X-ray. These will create pictures of your adrenal and the pituitary glands and help detect possible tumors, deterioration, or endocrine tissue problems. Other blood work. They will possibly do an ACTH stimulation test. The test involves measuring the level of cortisol in your blood before and after an injection of synthetic ACTH. ACTH signals your adrenal glands to produce cortisol, and if your adrenal glands are damaged, the ACTH stimulation test shows that your output of cortisol in response to synthetic ACTH is limited or non-existent. Insulin-induced hypoglycemia test. Doctors will suggest this test if there is pituitary disease and the cause of adrenal insufficiency. The test involves checking your blood sugar and cortisol levels at various intervals after an injection of insulin. In healthy people, glucose levels fall and cortisol levels increase. All right, so what treatment are they going to do for patients who have Addison's disease? I put on here, what are the side effects of taking steroids? The reason for that is there are many reasons why patients take steroids other than Addison's disease. Patients who have COPD that will take steroids as an anti-inflammatory to help them breathe better. There's going to be patients who are going to take steroids as anti-inflammatory for muscular problems. We talked about the breathing problems. There's a whole slew of them. What I want you to understand and what I want you to kind of know is what are the side effects of taking them. And it's not a matter of actually, just affecting their hormones, but what does their skin look like? How do they feel? I took prednisone for a while because I had pneumonia pretty bad. The first 24 hours wasn't too bad. The second day, I practically itched my skin off because I couldn't stand it. It was a side effect of it. By the third and fourth day, I got so irritable and angry at everything, and those are pretty common symptoms. So, um, these patients are going to be taking hormones for the rest of their life, and they'll adjust things based on side effects and stuff. But again, it's not just the adrenal gland problem. It's also patients who would take steroids for other reasons and kind of understanding what those side effects are going to be. So for treatment for Addison's disease, there's oral corticosteroids. This is the Cortef, the prednisone, cortisone. These may be used to replace the cortisol. Your doctor may prescribe what they call fludrocortisone to replace aldosterone. They may also do injections. If the patient is ill with vomiting and can't retain oral medications, injections might actually be what's needed. If the glands are producing too much of a hormone, they possibly may actually do radiation treatment. If there are tumors involved, or if there's some sort of disease process that can't be necessarily corrected with medication or radiation, they may actually do surgery. Specifically malignant tumors, tumors on the adrenal and pituitary glands, and then if all else fails, hormones that aren't working, they might actually have to do something else. There's something also called the Addisonian crisis. This is where a patient will become hypotensive, hyperglycemic, hyperkalemic. Other symptoms will be dehydration, severe vomiting and diarrhea, loss of consciousness, low blood pressure, and stabbing pain in the abdomen, lower back, and legs. If you have been diagnosed with adrenal insufficiency, they want people to wear a medical alert, either bracelet or necklace or something to identify that, the Addisonian crisis is very real, and that, if you run into somebody who has, these symptoms or isn't acting right, or you come upon them and they're not conscious, at least you have something to be able to look at and say, hey, this is what's wrong with them. Interventions for Addisonian crisis is going to be hydrocortisone because they're lacking it, the 0.9% or normal saline because of the dehydration and to get their blood pressure back up, and they're also going to do dextrose for the energy. So now we're going on to Cushing's disease. Your body's own overproduction of cortisol. This may occur from excess production by one or both adrenal glands, or an overproduction of adrenocorticotropic hormone, also ACTH, which normally regulates cortisone production. And in these cases, Cushing's syndrome may be related to either a pituitary tumor, an ectopic ACTH secreting tumor, a primary adrenal gland disease, which is causing Cushing's syndrome and excess cortisol secretion, that does not depend on stimulation from ACTH and is associated with disease of adrenal glands. The most common of these disorders is a non-cancerous tumor of the adrenal cortex called an adrenal adenoma. Cancerous tumors of the adrenal cortex are rare, but they can cause Cushing's syndrome as well. Occasionally, benign nodular enlargement of both adrenal glands can result in Cushing's syndrome. So, in a nutshell, Cushing's disease, which I can't seem to say, is the overproduction of cortisol, essentially. It is also possible to develop Cushing's syndrome from injectable corticosteroids. For example, repeated injections for joint pain, bursitis, and back pain, inhaled steroid medications taken for asthma, or steroid skin creams used for skin disorders such as eczema are generally less likely to cause Cushing's syndrome than oral corticosteroids, but in some individuals these medications can cause Cushing's syndrome, especially if taken high doses. Again, let's go back to the patients who are COPD with exacerbation. Most of these people will have an exacerbation at least once a year. They'll be put on a lot of steroids in order to help them breathe better, and again, that can actually affect the adrenal glands. Common signs and symptoms involve progression or progressive obesity and skin changes such as weight gain and fatty tissue deposits, particularly around the midsection and upper back, in the face, and between the shoulders. Pink or purple stretch marks on the skin of the abdomen, thighs, breasts, and arms. Thinning, fragile skin that bruises easily, and slow healing of cuts, insect bites, and infections, and also acne. Here's a picture of what seems to be a poor girl. Other symptoms are going to be severe fatigue, muscle weakness, depression, anxiety, irritability, loss of emotional control, cognitive difficulties, new or worsening high blood pressure, headache, bone loss leading to fractures over time, and in children, impaired growth. In men, they may experience decreased libido, decreased fertility, and erectile dysfunction. And I posted this picture because I felt bad for the guy. His midsection has that striae markings, and it's because of the Cushing syndrome. In women, women with Cushing syndrome may experience thicker or more visible body and facial hair, and irregular or absent menstrual cycles. Diagnostics for Cushing syndrome can be difficult to diagnose because other conditions share the same signs and symptoms. They will possibly do a urine and blood test, saliva test, imaging test, and petrosal sinus sampling. And I think there's a picture of it a couple slides from now. But the petrosal sinus sampling is basically they'll go up your nose and test the blood from the sinus area because it'll actually show increased levels of the cortisol. For treatment, reducing the corticoid steroid use, reducing the dosage of the drug over a period of time while still adequately maintaining your asthma, arthritis, and other conditions. Abruptly discontinue these medications could lead to deficient cortisol levels, so slowly tapering off corticosteroid drugs allows your body to resume normal cortisol production. So for surgery, this is the complete surgical removal. For radiation therapy, if the surgeon cannot totally remove the pituitary tumor, he or she will usually prescribe radiation therapy. Medications are also prescribed used to control the cortisol production. So here's a transnasal transphenoid approach. Basically go up your nose into your sinuses and they actually can remove tumors from your pituitary gland. This is, I wouldn't say 100% safe, but there's always dangers to surgeries. But for the most part, it's been done so many times, it's very common. One thing that I have read and what seems to come up all the time is, there's a scenario that the nurse comes up upon this patient that has had this procedure done and they're having some sort of runny nose. And instead of actually just assuming that it's nasal drainage, it could possibly be drainage from the surgery. And what you'll do is you'll test the drainage for glucose, and if it is positive, it is a sign that there is something. I believe it's actually spinal fluid is what it is, as opposed to just sinus drainage. A couple things you're not going to be able to do. You're not going to be able to bend forward. You're not going to be able to, strain to have a bowel movement. You're not going to blow your nose. If you're nauseous, you want to be able to, kind of tilt your head. But, obviously you want to try to keep this clean and protected and less pressure as possible, things like that. So I have not had a patient who has had this done, but it's a possibility. That's for any of the endocrine problems. If it leads to the pituitary being diseased, they can actually fix some of these problems through this procedure. And I think that's it. So if you have any questions, let me know. And again, sorry, it was a lot of reading and there's not a lot of stories. And like I said, this is not common practice at the bedside of med-surg, just because again, these are patients that are pretty well controlled and maintained outside the hospital setting. So, all right.